A lot of patients come in at the beginning of pregnancy and want to know what I'm having. And a lot of wives' tales will tell you if the heart rate's fast, it's going to be a boy. I hate to tell patients, but that's not always the case. An active fetus has a heart rate anywhere from 120 to 160 beats per minute, and that's normal. So you could just have a very active baby and it not be a boy. Other things patients have heard is depending on how you're carrying. If you're carrying low, then it must be a boy. Every woman is shaped differently. They carry pregnancies differently, so this does not determine what you're going to have. You really have to wait. We have an ultrasound we offer at 16 weeks that can give you the gender, or there is a genetic test if you and your physician decide that's a good option for you that does also give you the gender early in pregnancy. So the genetic screening test, we offer 2 different options, and one of those does give you the gender, and a lot of patients are very interested to find out the gender, and that's a discussion I think each patient needs to have with their physician, decide if that's the good test for them to understand it fully, and if they do decide that, then that's done anytime after 10 weeks in pregnancy. So one of the most common questions I get in pregnancy is patients ask, when can I go get my hair colored? And it is fine to go to the salon. Typically, I recommend patients wait until they're through the first trimester, but you can get your hair dyed, have highlights done. You can get your nails done. I always recommend, if possible, to go to a salon that's well ventilated, but otherwise it's fine to do that. There's always a concern when you're getting your hair colored, is the hair dye getting absorbed into my bloodstream because it touches my scalp? And there's no studies that are able to be done on pregnant women as far as hair dye, because no one will volunteer to be in a study when they're pregnant, but it's not been found to cause any harm in pregnancy. So a lot of women ask, what can I do to prevent my stretch marks? And they need to know that they're very common. About 90% of women will have some stretch marks on their body after a pregnancy. Unfortunately, nothing has been proven really to help prevent them or make them go away, but things you can do: moisturize your skin, vitamin E. A lot of women use cocoa butter on their belly, and also just stay really well hydrated. Yes, you can keep your cat in pregnancy. We get asked that, but it's also a question we ask patients. We want to know if you have a cat. It's not because you can't be around a cat in pregnancy, but we want you to avoid the litter box. There's a bacteria called toxoplasmosis that can be in the cat litter, and so that's why we avoid that during pregnancy. Patients often wonder what we do. We have them pee in a cup every time they come in, but there's a lot we can tell about your urine in pregnancy. We check for sugar in your urine, we check for protein, which can be a sign of blood pressure problems later in pregnancy. We look for blood in your urine, so it's important to give us that urine sample every time you come in. Morning sickness makes women feel like it should only happen when I wake up and go away, and that's not the case. A lot of women have sickness all day during pregnancy, and it's just important that they talk to their physician about that. We have medicines that can help. Trying to eat small meals throughout the day can help kind of keep that nausea at bay. Things that can help prevent your nausea is to try to eat small meals throughout the day, avoid having an empty stomach, and times to call your physician is if you get to the point you can't hold down food or liquids, you need to call your physician and let us know. Morning sickness is not uncommon, and the growing baby does just fine during that time. The only times you really need to call your physician is if you're to the point you're vomiting every day and you can't hold down foods or liquids. That's when we need to see you and evaluate if you need any further treatment. Patients often get confused because in the office we will refer to your pregnancy as how many weeks you are along, and they often ask me, well, how many months am I? So the reason we don't use months is that pregnancy is not 9 months, it's actually 10 months or 40 weeks gestation, and each month has a different number of weeks in it, and so it's much more accurate to go by weeks than months. Prenatal vitamins are very important. If we get a chance to do preconception counseling, we always advise patients to start prenatal vitamins before you get pregnant, and that's because folic acid is an important nutrient you need early in pregnancy. But patients need to know they need to continue it throughout pregnancy, and especially postpartum if they're breastfeeding as well, not only for the additional calcium and other vitamins, but iron is very important throughout the pregnancy, and we want to avoid you becoming low iron or anemic towards the end of your pregnancy. Prenatal vitamins, some women have trouble with nausea. You can do chewable like Flintstone vitamins if you can't tolerate a pill. It's important to let your provider know if you're only doing the gummy vitamins because those don't have iron, and so that's a time we may need to give you extra iron supplements later in pregnancy. An old wives' tale that some patients will ask about is family members have told them don't lift your hand above your head because they get concerned that that causes the baby to wrap the umbilical cord around their neck. But that is not the case. You can move your body in lots of positions and it does not affect the umbilical cord in pregnancy. So yes, you can lift your hand above your head and you can move in lots of positions and you don't have to worry about the cord.